K Saran, ex-professor and head cardiology department, KG Medical University, Lucknow, and presently director cardiology, Medanta Heart Institute, Lucknow. SGLT2 inhibitors are known drugs for lowering blood pressure, but what is their latest position in heart failure with reduced ejection fraction? The European guidelines, August 21, and ACC updates now recommend these SGL2 inhibitors as class A1 drug to reduce deaths and re-hospital admissions in heart failure patients with reduced ejection fraction. So all patients now should be given quadruple therapy, that is over and above triple therapy. Triple therapy means RAS inhibitors, beta blockers, and MRAs, and the fourth drug is now dapagliflozin or empagliflozin. What about preserved ejection fraction and mid-range ejection fraction? There are no specific drugs, diuretics only for symptomatic relief. In recent trials, EMPA reduced trial, it was found that in mid-range ejection fraction and preserved ejection fraction heart failure, it was found to be effective again in reducing cardiac death and hospital readmissions for heart failure. And three new trials presented in American Heart Association November 21 using canagliflozin, sotagliflozin, and empagliflozin also showed that in these two mid-range and preserved ejection fraction SGLT2 inhibitors as a class drug are effective in reducing death and hospital readmissions. Thus, SGLT2 inhibitors in reduced ejection fractions are class 1 drug according to ESC 21 guidelines and ACC updates, and likely to become class 2A drugs in heart failure with mid-range ejection fraction and heart failure with preserved ejection fraction. I will conclude that dapagliflozin and empagliflozin are better as compared to the triple therapy because DAPA and CANA can be given in single dose, 10 milligram daily, no titration needed, and you just forget what is happening to the patient because the chance of hypoglycemia and hypotension is very minimal, and when patient comes out with some reaction only, you have to see. So these drugs will score over triple therapy as far as convenience of use is concerned, and the effects of these drugs start appearing within weeks of starting because we are starting full dose on day 1. So these are the two major advantage of SGLT2 inhibitors in heart failure with reduced ejection fraction and also in mid-range and preserved ejection fraction. Thank you.